PCOS is polycystic ovarian syndrome, and it is the most common endocrine hormonal disorder among women, according to the PCOS Foundation. PCOS is an endocrine disorder in which a woman has an imbalance of the female sex hormones, thus causing cysts on the ovaries, irregular menstrual cycles, infertility, and many other health problems. For many years, I had experienced excruciating pain, weight gain, infertility, and many other symptoms that I just couldn't explain. In 2012, I was finally diagnosed with PCOS. PCOS, according to the PCOS Foundation, states that polycystic ovarian syndrome is the most common hormonal endocrine disorder among women currently in the U.S. My desire is to bring awareness to all women who may be suffering from this disease but are unaware of it. PCOS has no cure, but it can be managed and lead to positive results. Today I'd like to talk to you about the causes, the symptoms, the complications, the diagnosis, and treatment of PCOS. What are the causes of PCOS? Well, according to the Mayo Clinic Health System, doctors do not know what causes polycystic ovarian syndrome, but there are several factors that may play a role in developing this disorder. Excess insulin affects the ovaries by increasing androgen production, which may interfere with the ovary's ability to ovulate. These are an example I have of a normal ovary. The follicle matures, ovulation is done. This is a polycystic ovary, where the follicle becomes immature and multiplies and cysts are produced. This is an image of a polycystic ovary. Other causes the Mayo Clinic healthcare system state are low-grade inflammation and hereditary. If your mother has been diagnosed with PCOS, the likability of you having it is greater. Some common symptoms of PCOS are irregular, absent, or prolonged menstrual cycles, obesity, the inability to lose weight, facial hair or hair all over the body, acne, oily skin, excess androgens, your testosterone, your FSH, your LH, infertility, pelvic pain. Many of these are common symptoms of PCOS. Some of the complications that may develop from PCOS are type 2 diabetes, high blood pressure, high cholesterol, infertility. One of the more severe complications is cancer of the uterine lining. Diagnosis is done through pelvic examinations of your doctor, looking for masses or growths, blood tests, which are checking your hormone levels, your FSH, which is your follicle stimulating hormone, and your LH, which is your luteinizing hormones, the thyroid panel, and of course an ultrasound to see if you have cysts on your ovaries. According to the Women's Health in Queensland, 2 of the following symptoms must be present for diagnosis. That is the polycystic ovaries and irregular periods. Treatment and management of PCOS, according to the National Library of Medicine and National Institute of Health, they published an article that states treatment and management of women with PCOS depends on their symptoms. Weight reduction, if needed, is going to be the first step your doctor recommends in managing your PCOS symptoms. The U.S. National Library of Medicine and National Institute of Health published an article that states diets recommended for obese patients low in calories with reduced carbohydrate intake may produce 5 to 10% loss necessary for the re-establish the ovarian function in patients. If all these lifestyle changes fail, your doctor may prescribe birth control or metformin. The treatments could also be surgical. The PCOS Foundation recommends that doctors may recommend hysterectomy, ovarian drilling, or cyst aspiration. Battling this incurable disease of PCOS can be overwhelming, but if we are well informed of the causes, the symptoms, the complications, the diagnosis, and treatment of PCOS, one can overcome this disorder with positive results. I am living proof of these positive results. I have 2 miracles, my sons. I am an overcomer of this disease. My hope is that you will be too if you are diagnosed with this.